and get started. I know we've done a bit of your initial intake today as far as your vital signs and stuff, and your heart rate was just a little bit elevated, but obviously you've been in quite a bit of pain, so that is to be expected. Now, I was going over some notes that the medical assistant took as she did your intake, and it looks like you had a fall recently.
Yeah, I like slipped and fell on the stairs, and it hurts right here now.
Okay. The stairs. Are these the stairs at your house? Okay. Okay. Just to do an initial pain assessment, about how much pain would you say you're in right now?
I'd say about like a 4 or 5.
So decent amount of pain, but not excruciating. Now, when was the onset of the injury? Did this happen yesterday, this morning?
Like 2 days ago.
2 days ago. Okay. So were you kind of trying to wait it out?
Yeah, a little bit.
Okay. All right. So fortunately, sometimes when you fall or you have an injury, the pain doesn't onset right away. It can take a couple of days. So it's good that you came in to let us have a look at it. All right. Now, just to ask you a couple questions about the scenario in itself. Were you like carrying anything up the stairs, down the stairs?
No, I was walking down the stairs and like just missed the step, and from there it just tumbled.
I'm sorry to hear that. Any other injuries besides the arm? Did you hit your head, or no loss of consciousness or anything?
No.
Okay. Was it a witnessed fall? Did anyone see you?
No, they were in the other room and didn't come in until I shouted.
Okay.
I tried catching myself with this hand, and then...
So kind of braced yourself? Okay. All right. Have you done anything to mitigate any of the pain, like Tylenol, Aleve,
Yeah, I've taken some Tylenol. I put ice on it.
Do you feel like it helped at all?
A little bit.
All right. So I do notice just a little bit of swelling right off the bat. Obviously, I will do a physical assessment. Did you notice that there's been swelling that's kind of come and gone, or?
Yeah, it swelled up a little bit, and then once put some ice on it, it went down, but still a little aggravated.
Have you noticed any numbness of your fingers specifically? Any loss of sensation there?
Maybe like this one.
Okay. I want to have a look at that. Make sure there's no nerve damage going on. Now, can you point to where the most painful pinpoint would be?
Like right here.
Okay, so definitely. Okay. And if we were to gauge kind of how far up the pain goes, would you say it's like the entirety of your hand, or?
No, I think it's just like from here and then like a little bit down, but for whatever reason it shot up a little bit.
Medial, kind of at the joint there, so we'll say second extension and then down 3/4. Okay. All right, so definitely so far consistent with a fall where you've kind of braced yourself with your hand, which is a very natural reaction. Unfortunately, we go to put our hands down so that we don't hit our head. All right. So aside from maybe some loss of sensation could be due to the swelling, any kind of tingling sensation, like if your leg were to fall asleep and you start to feel static, anything like that?
No.
Okay. Have you noticed that it's particularly warm or cold to the touch?
Maybe a little warm, but not too bad.
And does the pain get worse when you do anything? So when you try to pick something up, when you're grabbing something?
I'm like trying to rotate.
Okay. So pain upon rotation. I'll definitely check your flexion and extension. We'll do some mobility testing as well. Right. Now I'm assuming you drove yourself here today. Did you have any trouble with that while you were driving?
I'm used to like doing tried doing it with my right hand instead of my left.
Are you right-handed?
No, I'm left, which makes this even worse.
Okay. That's not good. So we will definitely try to see what we can do. All right. left-handed. Okay. Any previous injuries to the area? Have you ever broken your fingers? Nothing like that. Okay. So it's not like we re-injured anything. All right. So we are going to go ahead and do a couple different things. I'm going to do a pain assessment, obviously. I'm going to test your mobility, see if there's any loss of range of motion, if you're having any issues with your dexterity. I'll have a look at your fingers. Definitely going to do some reflex testing, see if your reflexes are reacting normally. Maybe a bit of sensory just to rule out that numbness that you're having. I would guess it's probably just due to the swelling, which can be normal. And then I'll kind of assess whether or not I think you'll need a brace, which is more temporary. You can kind of take it on and off. Or if you'll need a cast, a temporary cast or a more permanent cast. So a brace, we'd like you to keep on for 23 hours a day. So really you would take it off when you shower and then you would put it back on for a certain amount of time, depending on how severe it is. Temporary cast is something that you would keep on for like a week or two, and then we could kind of reassess. It's more so just a splint to keep it immobile so that you're not re-injuring. And then obviously a more permanent cast is like the 6 or 8 week where you would have to have it on for quite a while. Okay. At this point I'm leaning either toward brace or cast. Temporary cast, I don't think you're gonna need a permanent just because it doesn't appear broken or dislocated to me. You probably wouldn't have been able to drive yourself if it was broken. So let's go ahead and do our assessment now. So let me just set this aside. There's plenty of room here. So I'm going to ask you to come just a little bit closer for me if you can. Whatever's comfortable for you. I don't want you to overextend it in any way. All right, so I am going to start with just a pain response test. I want to see where exactly the area is. I don't want to hurt you, but it is important that we kind of isolate pain here, okay? So I'm going to overextend quite a bit. I'm going to start at the shoulder. So any pain or discomfort here at all? No tenderness or anything? Okay. So we come down the forearm, nothing here at the elbow? No. Outer elbow as well is fine. Okay. And as we come down here,
it's right there.
okay, I do start to feel some warmth for sure here. Okay. So getting more painful as we come. Okay. Any more or less pain up here?
It's about the same there.
All right. So I do feel some heat here for sure. Now if we do outer versus inner, so we'll say this is outer left, inner right. Any more pain here versus here? Is it less painful on the inner or about the same?
It's less painful on the inner right.
See a little bit of distension of the vein here, which is likely just excess blood flow trying to heal the area. Okay. So I'm just going to do some gentle palpation too. It's probably going to be just a little bit uncomfortable. If it's too painful, let me know. I'm just feeling around here. I want to see if I note any protrusion of the bone, looking for any obvious dislocation, which I don't think is present. Gently going to feel along the thumb here. Okay. So I'm going to just touch your fingers here individually. Does this finger hurt at all? No. Here? No. Here? Here?
It's not too bad.
Not too bad?
No, it doesn't.
Are you able to flip your hand at all? Does it hurt if you turn? No. Okay. So same thing here. We're going to redo that pain assessment. So you have different structures of sensation on other sides of your arm. So any pain here at the shoulder?
No.
Down at the elbow? Coming down your arm here?
A little bit right there.
Okay, so I do feel again warmth here. I do notice some swelling here, so Notice that there's a little bit of a dip here, and then we've got some swelling coming up towards the injury site. So just taking note of that. And as we come up the hand,
it's not so, like, no.
Not as bad. So same thing, is that more painful here versus here?
Mm-hmm.
Okay. Any pain at the outer wrist?
Not as bad.
Not as bad. Still just slightly uncomfortable.
Mm-hmm.
And fingers here. Any pain at the pinky? No. Here? No.
It's like so.
A little bit.
Oh,
Okay. Is it more painful for you to have your hand at this position or the other position, or is it the same?
It's about the same.
Okay. All right. So let me go ahead and have you keep your hand like that for now. I don't want you to have to do too much switching back and forth. So I'm just going to take a light and have a little bit of a better look. So this is going to allow me to look at the swelling as well as any deviation or abnormality in skin texture, which can sometimes indicate more injury. I'm also going to have a look at the vein distension there, okay? So I'm going to start here. So definitely noting where the swelling starts here. Non-pitted swelling. So swelling is the body's natural reaction to pumping fluid and blood to the area, trying to create a protection barrier there. So it is to be expected. Unfortunately, it can also come with a few issues, as it can pose a risk of infection and occlusion, as well as lack of sensation. So just moving around. I don't notice as much swelling at the hand. It's mostly here isolated to the wrist. So look at the fingers, looking for any signs of discoloration. I'm looking for any paleness. If it looks like there's a lack of color, a lack of blood flow to the fingers. I see pink here, which is a good sign. So I'm going to try to do everything positionally. So as you have your hand on this side, I'll complete my test, and then when you flip, we'll repeat. I don't want you to have to keep flipping back. Okay. So I'm going to take a couple of measurements here. Up there, so just a little bit of swelling there. Slight distension here as well. So I'm going to try to just slide that underneath there. Good. So just the wrist. Okay. So I'm going to measure prior to having you move. Not noting any disproportion there. Definitely a little bit of swelling here. Okay. All right, so let's measuring this angle here, so seven. Okay. All right, let me just reach over here. My apologies. So I'm just going to take note of something here. So the inner elbow. I do have a little bit of migrated swelling. And then we were at 13.7 wrist. I'm going to test your temperature variation. So I'm going to start with an area that is seemingly unaffected so we can get a baseline measurement here. So starting off at about 97.1 average. So already quite a bit warmer there. Okay, so we're about 98.9 here above the hand. So we're still within normal body temperature, but obviously quite a bit of variation, which is just further indicative of the swelling. Quite a bit warmer there. Okay, so index finger there is definitely showing some signs of swelling as well. Do you notice any tightness of the fingers? You know, sometimes if you have too much salt, you might feel like a little bit of tightness.
Occasionally.
Occasionally. So overall, there is definitely a difference. I wouldn't say it's anything that I think is posing a risk of infection, which is a good sign. So. Okay. Right. So I am going to do another marker for pain here. Now, at this point, do you feel like you're in so much pain that you need something to help with the pain before I proceed with the examination, or do you think you're okay?
I think I'm okay.
Okay. So if at any point it becomes so painful that you need medication, then we can go ahead and do that and give you a couple minutes before we come back, okay? So just feel free to let me know. So this tool is going to allow me to apply just a little bit of pressure. I will try to be delicate, obviously, so I'm going to start and kind of work my way down. I want you to tell me when you very first start to feel any signs of discomfort.
Okay.
So again, starting at the shoulder is our marker for an affected site here. So no pain here.
Right there.
It's just a little washable chalk there. And then as we come up the hand, you still feel pain here? Here.
Yeah, but it's fading.
So tell me when you no longer feel any pain or discomfort.
Right there.
All right, now similarly, now that we have kind of a generalized area, I'm gonna come around and I want you to kind of help indicate where it starts. So if I start on this side, do you feel pain here?
Very faint.
Very faint, okay. At what point would you say it starts to really hurt?
Like right there.
Okay. And if I come around this side, do you feel pain here?
A little bit.
A little bit, okay. So the medial side is fairly painful through. So we'll say this is our first indicator here. And if we come up, is it painful in this area?
A little, but not as
Not as much. So would you say it kind of comes over this way?
Mm-hmm.
Okay. Can you indicate where, at what point coming up diagonally?
Where it starts or where it ends?
Where it starts. So let's say you feel pain here, but as I come straight up towards your ring finger, it doesn't really hurt. Does it hurt at the middle finger?
Yeah.
Yeah, okay, so you do feel pain here still. Out of diagonal, say 3/4 way of the third digit, and most of the wrist is still painful. Okay. This just helps me kind of isolate where exactly the pain is coming from, where the injury could be, what parts of your fingers are affected. So pinky appears mostly unaffected. All right. Now, I want to do the mobility very last because that movement is going to make it more uncomfortable. So I'm trying to get everything else out of the way before I have you start moving around and I see how much mobility you still have intact. So the next thing I'm going to do is do a very brief test of your sensory components because you said you were feeling maybe a little bit of loss there. I do think it's due to the swelling and not so much a neurological deficit, but we do need to check. So the first thing I'm going to do is have you identify whether or not you can feel something just very basic. So this is just a Q-tip, and you should feel that this is just a soft sensation. Okay? So I want you to just either nod or indicate verbally that you can in fact feel something. I'm going to start at the shoulder and work my way down, and it'll be varied. So just let me know. Okay? So can you feel this here regularly?
Mm-hmm.
Does that feel normal? Normal. Normal. If we come here and here. Normal here. Good. Okay. So completely unaffected area here. Does this sensation feel the same as this?
Mm-hmm.
Good. And this as well doesn't feel any different. And if we come around, none of that feels any different. Good. Okay. Very good there. And kind of opposite tactile sensation here. So this is not sharp, but pretty distinct. Can you feel that that's sharp?
Yeah.
Okay. Does that feel the same sharpness everywhere?
Mm-hmm.
No, less sharp. Doesn't feel dull anywhere.
No.
And you can feel this all here. And this feels the same.
Mm-hmm.
Good. Okay. And again, coming around, all feels the same.
Yeah.
Good. Okay. And for this next one, I'm going to have you extend your other arm as well. So we're parallel here. So I want to make sure that your unaffected side feels exactly the same as your affected. So I'm going to do it at the same time. So this should feel pretty identical.
Mm-hmm.
Good. And so. So no difference in sensation there. Very good. So that's a good sign. Obviously we will test on the other side as well, but just initially that is very good. So let me just document quickly here. Bilateral sensation, posterior side is intact, as well as soft sensation and sharp. Okay. Okay. So now I'm gonna have you flip your hand. Very good. Does that feel okay?
Mm-hmm.
All right. So we're just gonna essentially repeat everything that we just did. So I'm gonna start by taking some measurements. So we have about a 1/4 inch of swelling here. I'm gonna very gently bring this in. Before I touch you anymore, I'm gonna test for temperature variation on this side because I do feel quite a bit of warmth comparatively to the other side. So, okay, the gun is not picking it up, but we'll just that's good. So I do see some distension here. All right. Okay, so let's do our pain assessment here one more time. Okay. So same thing, I'm going to start at the shoulder and work my way down. So you just let me know if and when it becomes painful. So I shouldn't feel any discomfort here. Alright. And as we come up the hand, I'll come down first. Do you feel any pain here? Tell me when it becomes painful.
Right there.
Measure that spot here. So we have a smaller margin on this side for sure. We're at about 3.5 inches. The internal. Okay. Now, same thing as far as the outer 2 fingers. So if we're at this margin here, any pain here? In here? In here? Okay. So we are right about medial there. Enough for me to see it. To measure there. And again, about 3.5 inches there. Okay. Alright. Now, are you able to tell me if the pain on the outer portion of your hand hurts any more or less than the inner portion of your hand?
It hurts. They're about the same.
About the same. Okay. So you have a larger portion of isolated pain on the outside, a smaller portion on the inside. I do feel like our injury kind of is isolated here to the outer thumb area because that's where most of your swelling is lying. So let me just mark down those measurements here quickly. So we had 3.5 inch margin medial to wrist between the second and third digit. Alright. Okay. Now, if you could describe the pain, would you describe it as throbbing, pulsating, achy, dull, sharp, shooting?
I'd say throbbing.
Okay. Do you ever have any sporadic kind of sharp shooting pain, or it's just always throbbing?
It's just throbbing.
It's always throbbing. Okay. All right. Okay. Same thing here quickly with our sensation. So we've kind of isolated that you don't have any sensory mishaps at the upper forearm there. So I'm going to move down here. So do you feel that this is soft?
Mm-hmm.
Does it feel the same softness everywhere?
Yeah.
Okay. So no change in any of the digits. And if I could have you extend your other arm for me. Does this feel about the same?
Mm-hmm.
And no difference here in any of the fingers. Thumb feels exactly the same.
Mm-hmm.
Good. Okay. And you can tell that this is sharp.
Yes.
Same sharpness. Good. And you can feel me touching your hair.
Yes.
Okay, so I would say that your sensory function is intact. I think any mild lack or loss of sensation that you're having is really probably just due to the swelling, which could come and go as the swelling kind of increases and decreases with ice. Also, as well as if you ice your hand, obviously you're going to be a little bit numb. So that's okay. I'm not too concerned that it's affecting you neurologically or your ability to sense anything. Okay. So now we are going to move on to the portion where I have you kind of manipulate a little bit. I'm going to take some measurements of what your mobility level is now, and then when I have you come back in for a follow-up, we will retake those measurements and see what has changed. Okay? So as we do this, I'm going to ask you what your pain level changes to, that way I don't have to keep having you move it up and down. So I want you to bend as far as you can at the elbow, bring your wrist in. Is that painful at all?
No.
Okay. So as far as you can extend there, I'm going to go ahead and take a measurement. So that's very good. Okay. All right. And then very gently, just to the point where it becomes uncomfortable, how far can you bend your wrist?
Right there.
Okay, so definitely slightly diminish there. We're not getting 119 degrees there. Right. And if we just bring fingers up here, is that painful?
No.
No. Okay. Right. Okay. And are you able to bend at the middle hand, or is that just at the fingers? Is that as far as you can extend? Does that hurt at all?
It doesn't until I bring like my
Until
thumb
you
in.
bring your thumb. Okay, so until you try to extend your thumb, then it's okay. All right, so keep your hand just like that for me. I'm just gonna take a note here. We are 155. Okay. And then can you stretch your fingers and lie them flat? Does that hurt at all? No? Okay. And then if you separate here, any pain there?
Just in the thumb.
Just in the thumb. Okay. Alright. If you bring your fingers together like this, pain in the thumb as well. Okay. I'm going to hold your forearm here. Are you able to rotate your wrists like this at all? Does that hurt?
A little bit.
Okay. Does it hurt more to go out towards the thumb or in towards the pinky?
In towards the pinky.
Okay, so the extension is definitely inhibited there. Okay. All right. So lastly, for mobility, I'm going to place my hand here gently under your forearm and just kind of carry the weight of your hand. I want you to attempt to just completely rotate your wrist if possible. Okay, so you are able to rotate. How much more pain would you say that causes? So if we're at a 4 at baseline.
Went to like a 6 or 7.
6 or 7, okay. All right. Definitely diminished mobility, rotation. I'd say your flexion was actually intact. Extension, though, was slightly diminished. Okay. And at the onset of injury, do you remember how painful it was in the very beginning? Was the initial pain level like a 10 or?
No, I don't.
No, don't remember. It's okay. Oftentimes we just kind of block it out because it's not a memorable experience, so that's totally understandable. Okay. Has the pain ever woken you up out of your sleep?
No.
Yeah. Do you find that you're having to position yourself a certain way to go to sleep, or
Yeah.
Okay. All right, Samantha. So I am going to do one final test here. This is just a regular physical therapy putty. It's a little cumbersome to get out of the container. I'm going to hand this to you, and I want you to attempt to just squeeze it as much as you can. So as much as you can without causing too much discomfort there. So.
Like about there.
Okay, good. What we will do is set this, so now that it's been exposed to air, it will set and dry. And then when we have you come in and retest, I will have a new one and we will compare the two and see. So it's just another indicator of if there's any changes here. So I'm going to allow this to just air dry as is. And I think at this point my recommendation is going to be that we go ahead and give you a cast. So what I'm going to do, if you're okay with it of course, is a temporary cast. So it's a wet cast. I'm going to apply some strips. They don't have water on them. It'll get hard. It is similar to a permanent cast, but it's not going to be as hard. So you have just a little bit more mobility. You still can't get it wet in the shower. Mm-hmm. So at this point, I would say we should keep it on for about 7 days. I'll have you back in and then we'll take it off and reassess. And then should we need to put it back on, we can. This looks to me more as a minor to moderate sprain of the wrist, specifically of the thumb. So I would say 7 days should be okay as long as you're, keeping up with your adequate care, keeping it still and not overextending. Okay. All right, Samantha. So we have done your initial assessment and I am ready to go ahead and get you casted. So in order to do that, we need to prep the skin completely. Okay. So I know you're in a fair amount of pain. I'm going to try to take it easy and obviously not be too firm. It is important, however, that we cleanse the skin thoroughly to remove any bacteria that could possibly be lying on the skin so that it's not just kind of sitting there festering, as you won't be able to clean it while you have the cast on. Okay. So I'm going to start by just putting a towel down. So we'll just rest your hand on that for me. Perfect. And just put your hand in whatever position is the most comfortable, which I realize is probably none of them, but I am going to start by putting on a pair of gloves. Now, for the purposes of this procedure, I want it to be cleaned thoroughly. I am going to be applying sterile gloves so that I don't potentially infect you with any bacteria that's on my hands. Obviously, my hands have been cleaned, but still. So I'm going to go ahead and put these on. Alright, Samantha. So now that I have my jacket and my gloves on, we can go ahead and proceed with the preparations. So, let's begin with a simple cleansing solution. Now this is just sterile saline water, so this is going to be just a general prep, kind of get away any debris before we move on. So this is just a little bit cold, so I'm just going to go ahead and cleanse the area mostly at the injury site. Just make sure I got all of that out. Just try that off. Let's let that air dry a little bit. Now, you don't have any allergies to any kind of surgical prep, CHG, soap, or anything like that?
No.
Okay. So this is just a chlorhexidine prep applicator, so it's going to come out orange. It will wash off. It's not going to stay in your skin. Just get it mixed up here. So we'll start to turn the sponge orange. Okay, perfect. So I'm going to go ahead and cleanse the area. It just kind of smells like alcohol, so just a warning, you're going to smell some chemical smells. And we are going to clean the entirety of the site, so everywhere that the cast will cover. And this is an antimicrobial as well as a surgical solution, so it is going to completely disinfect the area. This is causing you any discomfort?
No. Just let this side dry for just a second. If I could have you rotate your hand for me, just take your time. Don't want to cause you too much discomfort there, so I'm gonna let that sit for just a second so it can dry. Shouldn't feel any stinging or burning or anything, but it can feel just a little bit sticky. Alright, so this last step is barrier film. So essentially this is just going to provide a layer of protection between your skin and the cast itself so that none of the chemicals from the plaster can infiltrate, penetrate the skin essentially. So
This is CHG compatible, so it's not going to undo any of what we just did. So I'm going to slide this across the skin. Maybe rotate your hand for me one more time. Now this one for sure can leave a bit of a sticky residue, so it does go away after it completely dries, but initially it can be just a little bit cumbersome. All right, so now that we have thoroughly prepped the area, I'm going to let you sit for just a second while I go ahead and prep our plaster and supplies to get you casted. So give me just a couple minutes here, okay?
Okay. All right, Samantha, I have everything prepared, and now that we've thoroughly cleansed the area, let's go ahead and get started with the casting. It does set fairly quickly, so I'm going to lay this up underneath your hand here, and we will go ahead and begin with application. Now, it might feel just a little bit odd. Obviously, it's kind of wet and sticky, not the ideal sensation. We will go ahead and begin with application here. It is a little bit warm. It's not going to cause you any pain, but just a fair warning. So I am going to begin this way. Now we typically overextend just a little bit. The movement here, just ensuring that we get a good fit. Okay, so I'll leave this one. So this isn't going to be as snug of a fit as a more long-term cast would be, but it does provide enough support to inhibit mobility, which really is the goal. Bottom pieces are a little bit warmer because they were kind of insulating each other. Okay, so I'm going to have you rotate your arm for me if you can, just like that. curing strip this way. So I'm gonna fold. So this will be a bit of a brace for the thumb to kind of hold that in place there. Now I will say, of course, with anything that's being applied to your skin and is gonna sit for several days, it's gonna be a little bit itchy, just for fair warning. Okay, so I know that can be kind of annoying. I don't recommend sticking anything inside the cast to scratch. I have had patients do that. Oftentimes results in infection, so you don't want to stick like a pencil or anything down there and potentially scratch your skin because you're not able to cleanse the area because it can't get wet. You're then just leaving bacteria to kind of fester. So definitely don't recommend that. If the itching becomes unbearable, you can take something like a low dose Benadryl to help a little bit.
Okay.
Okay, so that is fairly secure. I'm gonna have you rest your hand down. It will weight as much as you can, and that will help it set on the back end. So typically only takes about 15-20 minutes for it to fully harden. Okay. All right, Samantha, so got about another 15 or so minutes before this is gonna set completely. So I'm gonna let you sit here. Try not to mobilize at all, so just keep your arm where it's at. I will have the medical assistant come in and check on you in about 20 minutes if she feels that it's been set enough. She's gonna go ahead and put you in a sling, so I'll just show you. She's just going to place a regular temporary sling. It's going to just help keep your arm in place, okay? So you don't have to wear this all the time. I would recommend that you wear it at least for the rest of the day. This is going to feel a little bit heavy as well, so it'll just kind of help with the weight of that. So she will help you put this on as soon as this is ready. So I am going to step out. I've got some dictation to catch up on. If you have any questions before she comes in, you can just hit your call line.
Okay, thank you.
Thank you so much. All right, Miss Samantha, how's it going today?
Good.
Good. How are you feeling?
Good. I'm ready to get this cast off.
Okay. It's been about 8 days now, so I can see that my MA has already started the removal process. So these casts are water soluble, so which is why we tell you not to get it wet. So we've had her wetted, we've had it sitting, and now I should be able to peel it off. So tell me how everything's been feeling. Are you feeling any better?
Yeah, it feels a lot better.
Feels a lot.
I'm just, very itchy
Very
like you said it would be.
Very itchy. Very understandable. I'm sure you are ready to get it off and wash your arm. Was it hard to keep it dry in the shower?
No, we ended up putting like a plastic bag over it to keep it
Okay.
covered.
And how are you doing with using your right hand for everything?
It's been a little bit
Consider
difficult.
yourself ambidextrous now?
Yeah,
Not quite?
not quite.
Okay.
My writing looks like chicken scratch.
So I will go ahead and start the removal process. Now, obviously, you haven't been able to mobilize it as much because it's been in the splint. So we'll see once we take it off. We'll kind of redo those flexion and extension tests of your mobility and see how it goes. So I'm going to start to see if it's soft enough to begin the removal now. Oh yeah, we're good. Okay. These less permanent casts are nice because then I don't have to break out the surgical saw to cut it off. So just gonna have to peel back the layers here. Try not to pinch you in the process. There we go. are free. So just initially, how does it feel?
Feels good.
Feels good?
Mm-hmm.
Okay. So obviously we need to clean the area and get some of this off of you, but just rotating the skin, I don't see too much discoloration here. So I think what I'm going to have you do is go ahead and wash your arm. Let's get the rest of this residue off, and then we will do the reassessment and see how everything is feeling here. Okay?
Sounds good.
Alright, so how's everything looking?
Good.
Feels okay? Does your skin feel irritated at all?
A little bit, but
A little
I'm
bit,
sure
okay.
it's just.
So I do see some areas of some pinkening here, obviously, where the cast was touching your skin. But just to start, for pain isolation, do you feel any pain at all at this
No.
point? So obviously you were in there moving your hand around and it feels okay. Okay, good. Very good. Okay. So let's do a little bit of a reassessment here. So as I come down the arm, no pain at all here?
No.
Good. And if we rotate, there's no pain on the interior side. I do note just a little bit of a scratch there, but that's okay. Okay, so no pain at the thumb anymore?
Mm-mm.
Good, very good. Noticeable diminishment of that swelling here. Just gonna look at the integrity of the skin. So I do see some dimpling where you see these divots. It's just from where the plaster from the cast has been pushing into your skin. So obviously that's normal and that will go away. Overall, looks very good. No signs of rash. Doesn't appear as if it was sitting with moisture underneath, which is obviously a good sign. A little bit of pinking here. Okay. Alright, so let's go ahead and redo some of the testing we did initially. So I'm going to start with just a reassessment of the mobility here. So the initial test we did was raising elbow up here, so wrist to shoulder. So let's see if you're able to perform that once again. Any pain or discomfort there?
No.
Alright, and then secondary, I will have you flip your hand for me. And if we could bring wrist up as far as any pain there. And then obviously mobility in the fingers is better, but if you can bring your fingers as close to your wrist there, any pain at all with that? Much better there, okay? And if we stretch out at the finger, nothing there, and in. And if you make a tight, tight fist, no pain there. Very good. Alright. And then as far as temperature, I'm not feeling any differences this time. So last time there were noticeable hot spots, different areas of the arm. Today it feels pretty even throughout. You actually feel slightly cool to the touch here. So average reading this time is 96.8, so we are noticeably down from your initial visit. If you could rotate for me. Actually a little bit below average on this side now, so also could be because you just washed your hands. Okay. Alright. Okay. So I'm just going to do some palpation here, so feeling for any areas of swelling.
rigidity here. I'm definitely noticing a loosening of the joint, not quite as rigid as it was before. Fingers are slightly cold. Would you say that's your baseline? Okay. So the warmth previously was obviously just due to the injury. So I'm going to do some rotation here of the digits individually. Any pain or discomfort there? Good. This way. Here. Squeeze, flex and extend, all of that is good. Alright. So I'm going to do some tapping at the joint specifically. Now you will feel like a pressure sensation, but it doesn't typically hurt.
Okay.
Okay, so now I'm going to test the reflexes specifically. So I will come closer to you here, and I'd like you to just rest the weight of your arm kind of in my hand. Good. Very good mobilization there. Good. Same thing here, just go nice and loose. Very good. I'm going to rotate your hand here. Good. Right. So I'm going to test the reflexes of your inner palm. So I'm going to have you just kind of look straight ahead for me. Good. Okay. So no abnormality noted with that. Now, we did a test previously of your grip with the putty, so I have a new putty here and I'd like to retest. I did just look at your first one a little while ago, so squeeze it as hard as you can for me. Okay, very good. So quite a significant difference there if you remember your initial one. Very good difference there. All right. Okay. So let's go ahead and retest your tactile sensation as well as pain response. I'm going to also add in a different one this time, and then I will get you splinted just as a precaution. I'm also going to do a bit of a stethoscope examination. So
Okay.
let's start with your pain assessment here. So hoping that all of this will be negative, but obviously let me know if anything is still even just a little bit uncomfortable. So as we come down, any pain or discomfort anywhere?
No.
Good. Nothing here. Nothing here. Good. You flip your arm for me. Any pain or discomfort anywhere? No. And this is the most affected area. Nothing here. Very good. Okay. So let's test bilateral sensation response to start off with. So if I can have you extend that arm for me. So just as we did on your last visit, does this feel exactly the same? Any difference as we come down? Same. Good. A bit of a variation this time, so I feel that that's soft. You feel that this is pretty sharp? Okay, so does that feel soft or sharp?
Soft.
Soft or sharp?
Sharp.
Soft or sharp?
Soft.
Soft or sharp?
Sharp. Soft. Sharp. Sharp. Soft. Sharp. Soft. Soft. Sharp.
Good. Okay, so there was one variation there, but it could have been just a slight discrepancy. So
Now this is just the shove. You can keep your eyes open. Does this feel the same everywhere?
Yes.
No different anywhere here?
No.
And that feels the same outside?
Yes.
Good. All right. This is more about testing bone conduction here, so you should feel vibration.
Mhm.
Vibration.
Mhm.
Vibration. Vibration.
Yes.
Vibration.
Yes.
And vibration all along the knuckles here.
Yes.
Good. We'll do one more. Feel vibration here?
Yes.
Tell me when you no longer feel it.
No.
And you feel that this is cold.
Yes.
There's no areas where it's not cold.
No.
Perfect. Okay. So let's go ahead and do just a bit of an evaluation here now. Purely listening with the stethoscope, for blood flow. So it's not like when I check your heart where I can hear your heartbeat in your arm, obviously, but it does allow me to hear for any occlusions of the artery. So it is a little bit cold. Just gonna listen here. And I can actually hear your heartbeat at the inner elbow, obviously. That sounds good. Okay. So I'm gonna have you make a tight fist for me. Tight, tight, tight. Okay, you can release. So that just increases blood flow to this area where we've occluded the hand. All of that sounds very good. So no bad news for today's visit. I'm just gonna take a couple notes here. So just remove my gloves. All right, so we have essentially concluded your follow-up examination. I am going to, if it's all right with you, I would still like to apply a very temporary splint, mostly just to get you through the next 24 hours. So
Okay.
I've got some physical therapy tape here. It's self-adhesive, so it's not going to stick to your skin, but it is going to just not so much keep you immobile, but it provides just a little bit more support. So just because your hand has been in the cast, which has kept it still, day one, first 24 hours, I like to provide you with kind of a middleman between no cast and cast.
Okay.
So this is just going to give you a little more support there. Okay? All right. So sensory function is completely intact. So obviously the diminishment of sensation you were feeling was due to the swelling, which has since dissipated. I don't see any signs of edema, no abnormal redness or discoloration, no signs of erythema. You were able to feel everything adequately, and your mobility is definitely intact, which is good. Range of motion has improved. All right. So let's go ahead and get you wrapped. I went with a neutral color. We do have some bright colors, but I figured
No, neutral's
you're
perfect.
probably out of the age range to want a bright color. Alright, so I'm going to start here. It is going to be a little bit past the point of your initial injury. So like I said, 24 hours, you can go ahead and take this off. You can get this wet. I wouldn't recommend it. It doesn't feel very nice when it's wet, but it is waterproof. So
Okay.
if for whatever reason it gets wet, it will dry. It just tends to feel a little bit unpleasant.
was kind of annoying, but I'll just keep it still. All right, Samantha, you should be good to go. So like I said, 24 hours, so maybe when you wake up tomorrow morning, you can go ahead and remove that. Should you feel that the pain comes back after a couple days without having the cast on, I would recommend you come back in. At that point, we would probably take an x-ray to see if there's anything that we maybe missed upon the first visit.
Okay, sounds good. Thank you.
Do you have any questions for me before you leave?
Not at the moment.
Okay, all right. Well, I hope you feel better and please get home safely.
Thank you.
Thank you.